I'm Dr. Deepak Kapoor. I'm president of Advanced Urology Centers of New York, the largest urology group practice in the United States. And I'm also president of the Large Urology Group Practice Association, representing about a third of private practice urologists in the United States. The recommendations of the American Urological Association, which has really put together the most comprehensive set of data on this, is that patients who are particularly high risk for the disease, and the high risk populations are African American men and those with a prior family history of the disease, and that's on the father's side, a first degree male relative. So your father, a brother, your father's brother, paternal uncle. The disease trait doesn't seem to pass down through from the mother side of the family. So it's a paternal risk of the disease. That for that risk population, that you should talk to your doctor about whether screening is appropriate for you starting at age 40. For everybody else, you should start really seriously considering it around age 50. It's a common misconception that this is a disease that only affects the elderly. Another common misconception is that in the elderly, you just don't ever need to do anything about it. And that's just not true. There's been a lot of recent literature that has documented that given the fact that men are living a lot longer, that it may be more appropriate for a 70 to 75-year-old man to seek therapy than we historically thought. A very important study that came out of San Francisco last year documented that the majority of men who are 75 and older are substantially undertreated for prostate cancer. Now, I have to tell you, I've got a lot of the idea where every 75 or 80-year-old man is some moribund nursing home patient couldn't be farther from the truth. My dad's 81 years old, and I think he could still whip my butt if he wanted to. And he goes to teach every day, and he's still a very, very productive, active member of society. I have countless patients that are just the same. We shouldn't be writing those people off and saying that screening or treatment isn't appropriate simply because you're a certain age. We don't go ahead in this country and say that a 70-year-old life is less valuable than a 50-year-old life. It is appropriate for us to go ahead and look for the disease and manage patients on an individual basis. Cookbook medicine doesn't work for prostate cancer. You need to talk to your doctor and determine if screening is right for you. If screening is right for you and you have a biopsy, then every patient deserves to go ahead and have a treatment course that's customized for their particular situation.